I'm Gilbert. I'm the director of Central Vermont New Directions Coalition. We're a substance abuse prevention coalition here in Montpelier, and very concerned about the opiate problem, but also tobacco, alcohol, and other drugs. So we work with youth and parent education, bring speakers to the area.
My hat that I'm wearing right now is I work for the Vermont Department of Health. I'm a substance abuse prevention consultant, and I'm out of the Barry District Office, and I cover Washington County and parts of Orange, and all the way down to Rochester, Vermont, believe it or not. It's an odd shape. So I cover the full range from prevention, intervention, treatment, to recovery.
I'm Tom Croteau. I am a therapist that I just recently started working for the Central Vermont Medical Center as a clinical care coordinator. So I'm working with the hub and spoke model of treatment. Some of you are probably pretty familiar with that. Others probably have no clue what that is, but hopefully you'll have a better idea of what it is before we get done tonight. But essentially it's a state initiative to provide support to individual doctors and prescribers to help treat Suboxone, to help treat opiate addiction in the primary care setting.
So, our reaction to the movie.
Well, it's a difficult problem. We've also been, showing the hungry heart. I think there's a lot of, call for community awareness right now, and hearing about these college students who, are able to look at that right now in hindsight and how difficult it was and what a very quick downward spiral happens. And so where, our coalition comes from is all about prevention. How can we prevent any of that from happening, so that these kids do not even have to go to jail or go through treatment or the recovery. And part of the concern is maybe starting with other drugs like drinking alcohol and smoking pot and moving on. And part of it is, what is it inside these kids? What's that hole? What is that need to feel a whole lot better? And I think there's a lot that we as parents and educators and communities can do to help kids from a very early age feel good about themselves, so that they don't feel like they need to turn to a drug or one pill that's gonna do that for them. So.
I could say something. I would like to kind of take off on the prevention piece and just share with this group kind of the model. And I don't know if your camera can get this picture in, but everybody can see this. In Vermont, we have something called the prevention model, and it talks about how we can affect change at different levels in the community. How we affect it at the individual level where they have knowledge and they gain skills in how to deal with refusal skills, for instance. And there's some schools that even start in kindergarten by just trying to, there's something called the 40 developmental assets, and trying to remind people from the very earliest of age to tap into those assets. For instance, I think in kindergarten they have, there's one example that I really like where they teach 5 fingers, where they try to teach a kid in kindergarten to have 5 people that they can turn to. And it's an asset if they can find and name those people and to practice that in kindergarten, which is beautiful. And it goes all the way up through the grades. One thing that we have found is funding for prevention on those levels has diminished so much over the last bunch of years that we don't have as many people in the schools doing this work. And we know we need it. Yesterday, I was at the forum in Norwood, at Norwich University, and Dr. Chen, Commissioner Dr. Chen, talked about how he really felt money was going to come down the pike now from the national sources to try and beef up prevention. And I really hope and pray that it does, because we need it. We need it in the schools. We need it in coalitions. We have, when I started my job 7 years ago, there were 6 prevention coalitions in my catchment area, and now there are 2. So that shows there's just not enough funding for youth on that level. And getting to them in those early years is so, so, so important. I want to say just a little bit more about this prevention model. As you go up, relationships are important, to teach about relationships. Organizations, schools, that's where the student assistant professionals are in the schools. And they work with students on prevention issues. And they are really great. But we have very few of them now. We used to have them in many, many schools across the state. And now we have really very few, and very, very few hours in the schools. Like, they really could be there full time. And it's a funding issue. So hopefully our state will be beefing that up. Please, 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 and you can yell for that too, if you want to advocate for that. You know, it's something legislators need to hear from people, not from us. They need to hear from people in the community. Then there's like the physical, social, and cultural environments, community, and policies and systems. And a lot of the grants that have been coming to Vermont have been to deal with these broad environmental strategies. Right now we have a grant in Washington County called Partnership for Success. And its main focus really is to change norms in a big, broad way, to have law enforcement beef up their presence so that youth feel that they are around and that it will be effective to have that at parties so that they don't have as many parties. See, did that make sense? I think it was a little. And the main focus of the grant is binge drinking, underage drinking, and prescription abuse, which fits this movie very well. So we have something in our state called a prescription monitoring system, where the doctors have to use computers and register when they prescribe these very strong medications. And I believe right now they just passed it so that everyone had to, who was prescribing them, had to use that system.
Any narcotics.
Any narcotics? Okay. So that's great. That's a step in the right direction as well. It's not going to cover every issue that there is out there. It doesn't cover other ways that those prescriptions are sold in the state. It doesn't cover heroin and that people going from the pills to heroin and back and forth. So I could go on and on, but let me pass it on to you.
To give my initial reaction to watching the Opiate Effect, it really kind of dovetails with what these two ladies have been saying about the whole prevention. Bob Dick from Howard Center talked about how, you know, if we can teach these kids to think and to feel at the earliest stage possible. Over the last 5 years, I've worked at a private practice working with a lot of, well, in one location we had 100 clients that were being treated for opiate addiction. And almost every single one of them, a good majority of them, wanted to not think, wanted to not feel. There's so many things going on in their lives that they don't want to, they want to avoid. And narcotics are one of those things that you can take and not have to think or feel. There's other prescription medications and things like that. But to work with our youth, to work with our children, to be able to think and feel and express their emotions in a way that's positive and healthy instead of just avoiding. You know, avoiding can, in the earlier years, you know, it may be simple avoiding, but as they grow and they get involved in things later in life, it may be through entertainment, maybe through other things. And eventually, a lot of, particularly the clients that I work with, you know, it was drugs that helped them to avoid life and avoid thinking and avoid feeling. And so thinking about that on the prevention level really struck me. A lot of the people that were featured on the film talked a lot about that. That's my initial reaction.
Other comments or questions?
I felt like it was so depressing to listen to them. And that, you know, they said, you either die or you go to jail. And
When you become an addict, yeah, that's what it seems like their only options are. And they become physically dependent upon that.
I actually would disagree with that comment in the movie, because there are many people who can live on heroin for a very, very long time. I'm thinking of Keith Richards. You know, it depends on, you have the wealth, you can support it. It's one of those drugs that actually doesn't harm the system the same way some of the other drugs do. It's very different the way it is in your system. It's mostly not having it is the problem, and going through the detox and what people do, the crime that is done to attain the drug. But physically, it's not one of those, the worst of the drugs out there, which is hard to believe in a way. But when she said they die or go to jail, I know that isn't actually correct. Which is also something I think is important, to be honest with kids about what drugs do. I like, you know, Bob Bick in the movie again, he was saying, people say just don't do them, just don't do them. But that the kids, then they do them and they feel great. And they go, whoa, I think maybe they're lying about everything. So, you know.
That's a really difficult part of it. I mean, there's so much we can do in prevention about building up these, you know, developmental assets, but there needs to really be a lot more education about family history of having addiction. You know, I mean, if you already have the genetics to become addicted quickly, it happens very quickly. And you know, there are physicians who may have 10 patients. They all have the same shoulder surgery, and everyone gets the same pain medication. And one may choose not to take it and only have ibuprofen, and someone else may take one of those pills, maybe two, and you know, be able to set it aside. And then, you know, there's going to be somebody who's going to take one and say, wow, this is what I need, and I want to continue this. And sometimes when there's too many pills, they'll take them to school, or they fall into the wrong hands. They're selling them. So there does need to be a lot more prevention education just for parents to continue being parents about what drugs have been prescribed. Are you monitoring them? Do you know where they are you counting the pills? I mean, even if the kids are older, because you don't know if they are someone who's going to have that, that disposition to, that genetic makeup to be addicted very quickly.
Yes.
Yeah, prior to moving to Montpelier, for 3 years I was a volunteer in a prison. And the section I was in was for addiction. And, well, there were murderers, rapists that I dealt with. And so this movie was very, it brought out a lot of emotion in me. And what I noticed in my 3 years was that there was a lack of listening, or careful listening on the part of counselors and others who had come to visit, or in their backgrounds. Just the ability to listen to what these people were saying was lacking. So when I was there, I was a listener. But at the same time, I was there long enough, so I got to be pretty well respected, and they would tell me things. And I felt very blessed in that situation of being trusted, and let their emotions and talk about them come out, because a lot of times their backgrounds were lacking in terms of they had struggled when they were young in these not so nice situations. Yeah.
That's actually a great segue. We talked a lot about prevention, but what about treatment and what's available? And talking about the hub and spoke model, the hub, it's really to help provide, for most people, medicated assisted therapy, and for most of them that's Suboxone or buprenorphine, and some it's methadone. Many of you guys have heard of methadone. Suboxone's a newer version. Buprenorphine is a newer version like that, but it's designed more specifically and allowed by the FDA to be taken home with the clients, so it can be done out of primary care. And so when you're talking about counselors sitting and listening, the term medication-assisted therapy is something that we talk about. I bring it up a lot because a lot of the clients coming in, they want to say, you know, the Suboxone, it's a miracle drug, it saved me in my life. But when you really get down to it, what is Suboxone doing? What is the buprenorphine actually doing? The only thing it's really doing is keeping them from going to physical withdrawals. It's filling those opioid receptors, like the Oxycontin or the heroin or whatever else they might do. It's delaying the withdrawals. It's preventing them from feeling the physical symptoms. The real treatment happens in the relationship between myself and the client, between the counselor and the client. When I haven't seen any success with any of my clients without developing that relationship first. And it's hard to explain as a therapist, you know, what's really happening. And a lot of times it's just developing so they trust me, and I can tell them something very difficult, something that they probably wish somebody had told them 5, 10, 15 years earlier. Maybe it's a personality characteristic that's really annoying. So I've had to do that with some.
Sure.
Sometimes it's being the parent figure and saying, no, you can't do that. That behavior's, society does not accept that as an acceptable behavior, because you're going to go to jail if you keep doing that and doing those things. So it's through that relationship. I think you bring out a really important point in the treatment piece is also they've got to buy into that. What's their motivation? And so even if they come into the office and saying, I want Suboxone, I want the medication, they want that to feel better. They don't want to have to keep chasing the drug just to keep from feeling those horrible withdrawal symptoms. The number one thing that these clients want to avoid in their entire life is the withdrawal symptoms. They don't want it to be detoxing. That's being dope sick, as they might say. And so
is that part of what happens, that they have to go through detox?
No, they don't have to. And that's the point, is that they can come in, they may go into a mild form of it, and they're treated, so they're dosed properly on the medication, and then they can be on this medication for years. And the point of the treatment, and some say, well, why would you put this up there? You're trading a drug for a drug. I hear that all the time. You're just giving them another narcotic. The thing is it allows them to be stable, so they can spend, instead of that 90% of their day where they're spending chasing the drug and trying to find the next high, they can spend that 90% of time on more productive things, whether that's in therapy, whether that's finding employment. They can establish the relationships, healthy, begin to make healthy choices, and they can really start doing these things. So then when they have to finally want to address the physical symptoms, you know, actually the physical addiction, and they may want to begin tapering off that medication, they have the supports. They've developed positive relationships, whether it's with their family members, their parents, their siblings, significant others, people within their community, counselors, other supports. And then they can go through that in a slow and steady process and get back to normal life. And really, that normal life can begin for a lot of them almost immediately. And that's why they'll come and say, this is a miracle drug.
How about the young man that's in prison? You know, do they have that type of treatment for him and others in prison?
Unfortunately, no. If the State Department of Corrections, if they're not going to be if they go into jail into corrections without that prescription, they're not going to get it, period. If they are prescribed and they're going to be there for less than 30 days, then they will prescribe it for that period of time, as long as they have a physician that will continue prescribing it. Otherwise, if no one's going to cover it for them, they'll just be detoxed, and they have to go through it kind of cold turkey, and they come out of jail, you know, I would assume after 16 years, that particular gentleman isn't going to be physically dependent. But if he doesn't deal with all of the other reasons of why he wanted to use the medication, you know, what else was, you know, changing his contacts to people who, or I should say the types of people he interacts with, then he could go right back to it. And hopefully he does that work by himself with the help of a therapist, even in the correction setting.
I think this is a Tom question. At the forum at Norwich that Sarah talked about, I was there too, and they were talking about the fact that we spend so much on corrections, we can't jail every addict. And the governor was talking about scary people and not scary people, and by scary people he meant armed robbers and drug dealers, and by not scary people he meant somebody who writes a bad check or shoplifts or something to feed their habit. And what they were recommending was that instead of putting people in jail for drugs, that they consider that hitting bottom and that they go immediately into some sort of a treatment situation. Hub and Spoke was designed to try and alleviate some of those long waiting lists that we've heard about, you know, a year, more than a year before you can get into treatment and you may not be ready anymore. How's that going?
It's getting better. You know, at the private practice I was at, we wouldn't even take names, because we're saying, I can't realistically predict anytime soon, you know, within the next 6 months to a year when we might be able to get you in, because the wait lists were so long. Here in central Vermont, our hub has really been going since July 1st. It went online of last year. They've been slowly and steadily been increasing. They started out with about 80 clients. They're up to 160 now. They have the capacity to go up to about 450 clients, but right now there's a lot of logistics because of physical space, personnel. You have to. They want to hire one staff to every 40 clients, and so just the continual logistics is a huge process. I heard last week that the hub expects that their wait list will be eliminated as of the end of April, which it sounds great, but I guess as the boots on the ground, I kind of really want to see it happening because of you know, I'm still having problems getting people in there, and so what I'm seeing is a lot more people in the spokes. So the spokes, the hub is designed for the most complex clients, and that's where methadone is dosed out of, that's where Suboxone can be dosed out of. And for the most complex clients, they want to be treated for their spokes are our primary care physicians and some specialty treatment programs that a lot of them have been in our communities for many years, and a lot of us are not even aware of them. But I'm seeing the spokes are really stepping up to try to help out and take as many of these clients as possible. And I'm seeing doctors that have been really reluctant to take on. I had one doctor that had 30 clients, and 2 months ago, I heard him at a community collaborative meeting training saying, I'm never going to go over to 30. That's all I ever want to do. If I have one client that leaves because they successfully tapered off or they move somewhere else, I'll take one more in, but I'm never going to go over. Just yesterday, he said, you know, with all the extra support, which he's getting from this hub and spoke collaborative, where there's one therapist like myself and one nurse for every 100 clients, is we go in and we help that prescriber in that primary care setting to really work with them and do case management, therapy. A lot of them don't need therapy, so my job might be more coordinating to ensure that they are getting therapy somewhere. And so this doctor is saying, you know, I could take on another 10 or 15. So I'm seeing that happening, and I think that's where, as they're working on the logistics piece for the hub is CVAM. I don't know if CVAM is Central Vermont Addiction Medicine. It's up in Berlin at the old methadone clinic, if you're not aware of that. But they're working on those logistic pieces to really try and I was at the Blueprint conference today for the state, and they were really talking about seeing this they would really like to see this fruition of the Hub and Spoke initiative. They would like to see that come within the next 6 months and really see it reach its potential. And so I think we're on our way, but we're not quite there yet.
Sarah,
Yes.
you mentioned funding and people could advocate for funding.
Mhm.
So what are we asking for and where does the funding come from?
Those are all great questions. And I don't have any great answers for that right now. Talking to your legislator, reminding them, that there's a need. There are some bills out there, but I don't know that their prevention in specifically.
Are they state funding or are they federal funding?
Well, I'm talking state because of our access to our legislators. We have tremendous access in the state to talking to people about the problem. And they're aware of it because of the whole, state of the state from the governor. Everybody's talking about it. But they're not necessarily looking at the prevention edge of it. They're looking much more at the treatment. One thing I love that they're doing, that there's a bill out there right now, and gosh, if I can remember the number. Yeah, the number. I'm just terrible about that. But it has to do with rapid arraignment, and it has to do with catching people before they're charged so that they can go into treatment before they're charged. And that's huge. That's really giving an opportunity. And the movie that we just saw brought me tremendous sorrow in my heart for the family and for this young man who's in there for 16 and a half years. I mean, somebody who has sold heroin, maybe, like, was he one of those people that is so bad, or was he supporting his habit? And a lot of times they're supporting their habit, So jails to me are not the answer to this disease. This disease is huge. The other thing, to talk about that, I get calls every week in my office from families who are suffering because their child is sick with this disease. And they are usually so lost and scared and don't know where to turn, and they come to me. I don't know where my phone number's on all these different lists, but I get them, and I try and direct them to different places that make sense. But just remembering that this disease is powerful, and it's baffling, and it's consuming. And I love that Bob Dick in the movie really talked about it doesn't discriminate. It's rich, it's poor, the stereotypes don't fit. That's one thing that these community forums are really important to acknowledge, that, stigma is huge, and I think that's been, you will understand if someone has diabetes and they're in trouble, they eat a piece of cake, well, they're not a bad person, but they have to change their insulin, whatever. But with opiates and drug addiction, it still has tremendous stigma in our communities. It's diminishing, little by little.
Well, and that stigma even has been in the treatment world, thinking about and even within the primary care setting up until recently. If a person that they were treating for opiate addiction and they were providing this medicated assisted therapy and they happened to come up positive for cocaine or alcohol or something else, they just said, oh, you violated it, you're out. Just like what she was saying with the diabetic, just because a diabetic person eats a chocolate cake, you don't kick them out of the program, taking their insulin away and take their treatment away. I mean, that's what we're treating. We're treating the substance abuse, and it's more than just the opiate addiction, it's the whole person. We have to treat the whole person in order to give them an opportunity to really make the changes they need to make in their life, and not just, kick them to the curb when they make a bad choice. We all make bad choices.
When U.S. Attorney Coffin approached VPT about working with him to bring this out around the community, I screened it, and a couple things that I found that I really liked about this film. I remember being in high school and being shown Reefer Madness, and one of the test was, is it scare tactics? Is it something that kids aren't going to buy into, or is it honest and direct? And I found it to be very honest. I like the kids talking to kids. I like, in addition to forums like this, we've gone and we're working with high schools, we're working with middle schools, trying to get this out. And there are other films too, The Hungry Heart, as you mentioned, also very, very good. So those are things that I like. You raised an issue that I found kind of intriguing when, this year, 2014, I guess, there have been a couple high-profile heroin overdoses. Corey Monteith from Glee and Philip Seymour Hoffman. And one of the things that in what I was reading from friends of them kind of stated that there's really no such thing as a heroin overdose, that you really die from heroin, you don't die from the overdose. That it's not, if you just took a little less, you wouldn't have overdosed. And that whole dialogue needs to be changed. Is that accurate? Is that not accurate?
Looking at me. I think, I'm not a medical expert in that sense, so I'll put that caveat out there. When I've worked a lot with Suboxone, and the thing they say about why Suboxone or buprenorphine is safe is because it has a ceiling effect. In other words, it can only fill so many receptors. You can take more and more and more, and it's not going to get you any higher. It's not going to do anything for you. Unlike the contrast to that is pretty much any other narcotic. So buprenorphine is a partial agonist, and heroin or Oxycontin, Percocet, Vicodin, those are full opiate agonists. And those increasing amount will cause central nervous system shutdown. That's
So
really what happens. So
die.
you can die. So the more you take, it's not just the more you take. Oftentimes, I think it was with Philip Seymour Hoffman. There was kind of a cocktail. There were other CNS depressants in there. I'm not sure which, but very often we see alcohol, benzodiazepines, and other things like that. That combination is very deadly. And I've seen and heard lots of stories and reports of it's not the same every time. The person may take the same dose, and it's that one time they're safe and they're fine. The next time it's
Very
an overdose.
strong, different strengths, different levels of strength. I love that you brought up the benzos, because I think diazepines, because many physicians don't realize that combination is deadly, because they do different things to the system and depress the breathing. And, I'm not a doctor like that either, but I know that the benzos are causing lots and lots of trouble in combination with these drugs. And there needs awareness. We need to have an awareness campaign about that.
And the awareness comes in, I think Bob Vick also talked about there's not you watch commercials on TV there, it's all about taking medication or something, there's some kind of a drug out there to make you feel better. And so that too is ingrained in our society, it's in our culture that you take something. And so benzodiazepines such as Valium or Xanax or Klonopin, some of the names you may have heard, it's very similar to what the opiates are doing. It's going back to kind of my first comment about to think and to feel. They don't want to feel. And so these medications, those two will also do the same thing. They want to get benzoed out, or they want to not feel. They want to pass time because they're bored. Dealing with boredom is a huge issue that a lot of these people, what do I do with myself in the next 3 hours? All prevention topics to talk about too.
Read a book.
And that's in jail too, boredom in jail.
Yeah. In some of my previous experience, I worked in the state hospital here in Vermont. And seeing a lot of clients that they just knew they were going to be there, they wanted to pass time. So they knew what they had to do to get some drugs to help them sleep for the next 2 days, so they can help pass time.
So one thing I do want to say is that at the health department, there are some good resources for people in the community. There's it's called VADIC, Vermont information, can't even think of it's over there on the
Alcohol
table.
and drug information
Clearinghouse, so there's lots of stuff that people can go and look at. If you're a teacher, for instance, you can go find things for students that you can work with, and there's help there. There's videos and such, and it's just a great resource, so know that that's out there. There's also 2 annual take-back days coming up. There's one, I think, April 26th.
Saturday, April 26th is a national take-back day, and you can go on DEA.gov or call a local coalition or check the papers. Many of the police departments in areas throughout the whole state of Vermont are collecting prescription medications that are outdated or unused, and so you're getting them out of your medicine cabinets or, out of someone else's hands, and you can take those on Saturday, April 26th. There are also several places that have lock boxes in place where you can go year-round. One of the places locally is the Washington County Sheriff's Department, where our coalition helped have a lockbox built and installed there, and also the Berry Police Department. But throughout the state, this will be happening in April and again in October.
So is that all medications or just medications?
Not liquids, not syringes,
But pills.
but other
Capsules.
pills, yes, and capsules. Yes.
I was just thinking, I had surgery recently, and it was really being pushed, the OxyContin. I couldn't believe it. In the conversation, I said, no, extra strength Tylenol, I'm fine with that. I'm really going to be fine. You don't know, and you don't want to be up in the middle of the night, and I could not say no. I was not allowed, and I went home with this bottle of OxyContin. It's in my cupboard. I'm glad to hear that. I was bringing it to the sheriff's department, but I thought how easy, and when I hear stories over and over again of people who had a shoulder surgery or a knee surgery or whatever, and how that started that downward spiral.
Why do they push it?
Why do they push it?
They want to get called in the middle of the night.
Well, it's not just that. Probably back in, it was in the late 90s, early 2000s, the medical community really started to push, say we need to treat pain. And so they were pushing that, and I actually have heard from a lot of doctors, we don't want to get sued for undertreating a person's pain. And how many people are going to get sued for making a person a drug addict? Not many. But they have gotten sued for medical malpractice for saying, I've been in so much pain and you didn't treat me right. And so there's that part of it that was really pushed by the medical community. And now we're getting into where hopefully that's decreasing. Hopefully.
That is a month ago.
The word on the street is that it is. And that's exactly why we're hearing about this epidemic with heroin. We have a population that's primed. They've been addicted to prescription painkillers. They're ready, and that's being taken away. And what's coming in is cheap, inexpensive, and often good heroin. That's what, and that's why we're seeing an uptick in overdoses and other things, because it's not just here in the state of Vermont, but I mean all around. Pill mills in Florida have been greatly shut down, which is really great. But now we have to deal with this population that's been addicted to prescription drugs that may have felt it as being safe because this was as they talked about on the film. It's made by a pharmaceutical and it's safe.
I just have one question I probably shouldn't even ask. But what is the cure rate? What is the research? It sounds like the combination of the Suboxone and the counseling, building a relationship was, Tom, you were saying, the most significant.
Do you have numbers?
I do not have numbers for that, but, the word cure is an interesting term. When people can live a healthy life and hold down a job and work and take care of a family, that's a success. And there's been a lot of success with Suboxone. And methadone.
And that's what we have to look, is we have to change the treatment community, the primary care physicians, we have to change the definition of success. Because we want to say, kind of like a surgery and they have cancer or something, we cut it out and they're cured. Well, cut it out doesn't necessarily mean cure. So you put a person on Suboxone or some type of medication-assisted therapy, cutting it out might not be the answer. They may need to stay on for quite a long time, and that may be the definition of success for a lot of these people. And so we're seeing people that, you see people that come in and they have no relationship with their kids. They've been taken away and removed by DCF. They haven't had a job in a long time. They've been incarcerated and many other things. And then see them 2 or 3 years later where they're holding down a good job. They've gotten their custody of their kids back. They're, instead of being what some might see as a drain on our system because they're using all of our, reach up and food stamps and everything, they're actually good. They're paying in, they're working, they're paying taxes, and they're adding to the system. And those are that's what I see as success. And that's one individualize that changing one at a time. And from what I've heard from doctors and addiction specialists that have been doing this for probably longer than I've been alive, they've said, I've heard them say personally that before buprenorphine, they've never seen anybody successfully come off of heroin addiction. And now, I don't know what the numbers are, but there's a good percentage. It's kind of, recovery is ongoing. And I think, again, that's what kind of muddies the water when we think about success, is that this is a lifelong process. And so they may relapse, they may go back, they may lapse, but it still doesn't mean they're not necessarily being successful in their recovery. A lot of them are coming back, making positive changes, getting reestablished in counseling and things like that. And it's an ongoing process.
Do people who go to methadone clinics or some of the other treatment centers, are they court appointed? Have they been arrested and have access to it? Or can they just put themselves, like people with alcohol may put themselves in detox centers or something like that?
There's a certain percentage of people that are court ordered. There's a lot of people, we have a drug court here in Washington County, and so a lot of them may be mandated. Maybe they've been convicted or picked up for a crime like petty larceny or something else. That's most likely drug related because they were trying to feed a habit or something. So they're put into that court system where if they do treatment, whether it's Suboxone or treatment or whether it's some form of drug counseling or things like that, they can actually avoid the whole going into.
Do you run into the problem that, as an example, to get student loans to the kids who, she's 22 years old or something like that, she's trying to get her life back, to apply for a student loan? That's a question.
I've had a few that have had felonies from their 19, 20 years old for prescription fraud, for things like that, and
then you can't get the loan.
And then that's a good segue into recovery. And the recovery, Friends of Recovery Vermont has been trying to change some of that for many, many years and advocates to change some of those federal laws that say you can't get, sometimes they say you can't get housing also, public housing, federal loans. So there is some activity around that, but how soon it'll all change and shift depends a lot on everything in society.
Well, it's interesting you brought up college because it's, I don't think everybody knows that there are college recovery centers at many universities across the United States. And so for a lot of kids who have had a really tough time in high school and then want to go on to college, sometimes they think, I can't do that. I cannot be in that situation where, kids my age are partying, or how can I cope? And yet, these recovery centers, even here at the University of Vermont, will take in groups of students who have a built-in support system. They get what they need, and they can still function in a university environment. And I think it's important for guidance counselors at the high school level and parents and students to know that there is a way to make it work.
We were going to have somebody from Montpelier Pharmacy here. Do you know what they may have added to this discussion?
Just maybe in what they have seen, what the trends are, and how they're dealing with dispensing of medications on a daily basis. I think there were a lot of ways of doctor shopping and tricking pharmacies by being able to fill multiple prescriptions. And I think a lot of those difficulties have been addressed now.
Also with the pharmacies, working within the physician's office, my relationship with the pharmacist is really important. And so developing that relationship, so all people that are prescribed narcotics here in the state of Vermont now have to get it, what they call a pharmacy home, particularly for the Medicaid, I think specifically for the Medicaid population. And so they can only fill narcotics at one pharmacy. And so I know that, I've had many that have tried filling it at other places and I get a quick call. Or usually it's just denied right there. And I get a call from the client saying, hey, why'd they not fill it? Because they just weren't aware, possibly. But otherwise, here at the local pharmacy, my relationship with Rich at Montpelier Pharmacy has been really great. Clients would show up, they want to fill their script early. Or the pharmacist will call up and say, hey, they got a prescription from another doctor for benzodiazepines or something it's considered not counterindicated with Suboxone prescriptions. And so just having that close working relationship is, I think, a very important part of the treatment plan for these clients.
And Montpelier Pharmacy also uses a special bubble wrapping process where it's day by day what you're supposed to take, so it makes it harder to take too many too soon and run out.
Are there last words from each of you?
I think, well, I just want to talk just for a minute about the family disease of addiction, and not just the individual, but how the family has to try and cope with this. And really, I felt for this family in this film tremendously. And, just to know that there are resources out there. There's Al-Anon, there's Wits End in Barrie, there's Families Anonymous in Montpelier, and they're just great supports for families who are going through these difficulties, because it's incredibly painful for families. And you could hear the brother talking, and the father, and I could just feel their hurt. And almost all families struggle so deeply with this disease, and deeply with behavior like enabling. When can you stop enabling someone? How can you let them go? I just think that those, it's great to have other people to talk to, other families that are going through this, so you're not alone, and you realize that there is help out there. So that's my plug for the family piece.
And we talked a little bit about kind of some of the feelings of hope, of hopelessness about this disease and things. But the thing I really am seeing is I'm actually really seeing a lot of hope, really, with this. I really see this as in Vermont, in the state of Vermont especially, there's a huge paradigm shift that I think we're in the middle of right now, where we're getting a lot of press. We have the governor with the State of the State address. We have a lot of these initiatives coming in, and there is a lot of money that's coming in. And you had asked about the, where are these grants and things coming in? The hub and spoke is, I don't know for sure, but I think it came out a lot of that advocating back in 2010 that we saw in the film. And that was a $12 million grant given to the state to really get this up and going. And we have prevention, we have treatment programs all around the country that are looking at the state of Vermont right now. They're putting us under a microscope to see how well we do this, because they want to do the same thing. They have the same problem. And so I'm really feeling a lot of hope and a lot of excitement in the treatment community and in the prevention community coming up and supporting. And so we don't have, let's work on the people that are there now. Let's treat them. Let's do our best to keep people from entering this lifestyle. And I think there's a lot of hope out there. And, we're saddened and whenever we hear of these deaths, and some are much more public, or much more publicized and famous, I guess you could say, than others when we see them from actors and people like that. And then we have other people from right here in our own neighborhoods that are dying from this as well. And I think there's a lot of hope.
And I guess I would say it's really important to be a part of the community and the support systems that are there for kids and college kids and adults who might be suffering from this. And, I guess paying attention to some of those kids on the street that, look like they're having a rough time, and just connecting with them a little bit sometimes instead of walking right past. Sometimes it's just some little glimmer of hope, or something to make somebody feel like they matter, that each person is really a person. And, we're a prevention coalition in this area, but there are coalitions throughout the state of Vermont. Every community can reach out to their coalition if they need more help, or they think there should be more going on in the school, in their area. We have an organization of all of the coalitions called Prevention Works, and so we're fortunate to live in this state of Vermont where, yes, we have a common problem, but we're also small enough that there can be enough communication and dialogue.
There's more resources that I brought on the table, so grab some on your way out. Thank you.
Thank you to the library.